You're listening to Morning Inspiration Radio Show. MorningInspirationRadioShow.com. Now here's your host, Dial Tone, the producer.
All right, y'all, we back, and today our special guest is a board-certified family medical physician. He is licensed in multiple states and works in emergency departments, hospitals, urgent care centers, and with clients throughout the United States. He has over 10 years of experience and has treated children, adults, and various health issues. He graduated from Marquette University in Milwaukee, Wisconsin with a degree in political science after completing his pre-medical courses. My special guest also attended Sabre University School of Medicine, where he was also selected as the student body president. He completed his family medical residency at Aurora St. Luke's Medical Center in Milwaukee, Wisconsin. And he's currently licensed in 20 states and served as the medical director of nationwide telemedicine program. He's the recipient of the 2011 Health Nation Physician of the Year Award for providing exceptional care and currently works in hospital emergency departments throughout Houston, Texas. He's been featured on dozens of television, radio, and social media programs to provide expertise on medical topics, community health issues, and more. He's also an expert witness who's provided services to the state medicine plans, Social Security disability reviews, and Medicare complex cases. Ladies and gentlemen, I want you to welcome to the show today's special guest of Morning Inspiration, the radio host of Simple Health Radio, Dr. Muhammad Emran. Welcome to Morning Inspiration Radio Show.
Good morning, sir. Thank you so much for having me as a guest. I really appreciate that. No
problem. Now, you have a very unique podcast. The podcast is called Simple Health Radio, and people can tune in by iTunes, iHeartRadio, and going to your website, simplehealthradio.com. What brought about this show?
Absolutely. And that's a very good question. I get that asked a lot, actually. I'm an ER doctor, so I work full-time in the emergency department. I work days, I work nights, and every day I see new cases and a lot of people that have questions about their own health. Mm-hmm. So most of the topics that I cover on my show are very brief. The episodes are about 10 or 15 minutes long, but they're actually things I've seen that day on my shift. And some of the common things that come up are things like stroke, heart attacks, infections, but also things that people have just general questions about, like prenatal vitamins and what a lab test actually tells us. And so my goal with creating the show was really to answer that question, not just for that one person in the ER when I'm there, but to record it and then let other people hear about it later on. And that, I think, is a great way to spread the knowledge about what we do.
I think that's great because of the simple fact that there's a lot of tension between the public society and the medical world. A lot of people have, a lot of questions because we don't know what some of these illnesses are, what caused them, the symptoms. And so we're trusting the doctors. It's almost like going to a dealership and the guy is telling you all of these great things, looking for you to purchase a vehicle, but you're not sure if you're going to get screwed in the long run or if this is really going to work. It's almost the same concept when it comes to the medical world because we're putting our lives in the physician's hands. But this gives listeners an opportunity to hear it straight from the physician. Now, what are some of the feedback that you have been getting from listeners once they've listened to your podcast?
Absolutely. And I'm glad you brought that up because in my situation, I'm not selling anything. I don't have a book. I'm not in a movie. I don't have any procedures that I do beyond what I do in the ER. And so my expertise is really just neutral. So people, when they go online, I call it Dr. Google. The first thing that people do if they have a stomach ache or if they have a rash or they have something on their head that they're not sure about, they go to Google and they start typing in their symptoms. And it will give you a list of, a lot of possibilities. And so I need to be admitted to the hospital because I think I'm dying. And we take a look at it. We kind of go through some things. And then we find out it's just a mosquito bite. You see what I mean? And so we've taken that anxiety that people have about their health because the information is out there. It's certainly on Google and some of the other websites. But those are not written by doctors. Those are not monitored by healthcare professionals. And so the information has to be very broad. It has to be covering every possible scenario, which is not appropriate in this case. And so for me, the feedback has been very positive because I am a doctor. I do see this every single day. And I can tell people within about 5 minutes what they probably have and for sure what they don't have. And that's really been, for me, the best source of expanding that knowledge for them.
What are some of the most popular topics that people want you to cover, or the most popular questions, should I say, that you do get from listeners out of all the ones you cover?
We get a lot of questions about back pain. We get a lot of questions about knee pain and so forth, because people are very active and people want to be, able to be healthy. They want to get out and exercise and do things, but sometimes their body limits them. So a lot of people will develop back pain or knee pain, and they go online. They think they have arthritis. They think they have other problems, but really what they need is just education. And so a lot of the questions I deal with are not life-threatening necessarily, even though I'm an ER doctor, but they're actually to keep them out of the ER, to keep them out of the hospital and surgery. And so that's actually a large number of cases I get are just what I call musculoskeletal, things that people have pain with when they're trying to do activities and exercise and sports.
Got it. Now, my next question is a little bit different. Because you're doing this podcast, Simple Health Radio, and because you're giving of yourself, this puts a different spin on doctors. From a patient standpoint, we feel that the doctor's job is to prescribe us some type of pharmaceutical medicine or possibly do a surgical procedure, and then we are just another number. There's dozens of patients coming in, especially being an ER physician. You got a lot of people coming in that's being seen, and people don't feel this personal connection with the doctor. You being a doctor and can speak from your point of view, what brought about the desire to want to help people in this field in the first place?
Absolutely. So for me, my experience in healthcare goes back all the way back to when I was 15 years old. And when I was 15, I was a volunteer in the local emergency department at a hospital. So I wasn't the one doing CPR. I wasn't the one doing stitches and so on. But my job was to just get the wheelchairs and just to help the family members get to the right room and so on. And that's when I realized that healthcare isn't all about just the doctor. It's actually a team approach. And the doctor gives an order, the doctor recommends treatment, but it's up to the nurses, the pharmacists, it's up to the lab tech, the x-ray tech. All of those people have to be in sync in order for the right thing to be done at the right time. And so there's a lot of what I call behind the scenes activity that actually goes into keeping patients healthy, coming up with the right diagnosis, and then getting through a successful surgery. So my experience goes back many, many decades based on that one experience as a volunteer. Now, I agree with what you described in terms of the time crunch. And in the emergency department, anyone who's been to an ER, they find that they're waiting 5 or 6 hours to see a doctor, to get the results, to get discharged home. And that's unfortunate because the healthcare system right now is overloaded. The doctors are overwhelmed. The hospitals just don't know what to do. And people are getting sicker. I will say that people have more health problems now compared to 10 years ago. And that's just kind of the combination of obesity, combination of heart disease, high blood pressure, all of these conditions that 50 or 60 years ago, it was kind of a different world. People had different diseases, different problems, but now they're getting so complex. And so there's also this what I call corporate part of medication. So the corporate medications are things like big pharma. So these are drug companies that advertise on TV. They want people to be on this blood pressure medicine or that arthritis medication. And all of that has a cost. And so people find that, my medication is so expensive, I have to spend $200 a month for my prescription. I'm just going to stop taking it. And then unfortunately, they'll have a side effect and they'll end up back in my ER. And I always ask them, well, what medicines are you taking? What medicines were you supposed to be taking? And there's always a disconnect in that situation. And I'm not saying that everyone needs medication. I would prefer that people stay off their medication if possible. But if that is what I call a life-saving medication, if that's something that your heart needs or your kidneys need or your blood circulation, if it needs that medication, you have to make a decision on what to do. But it's a very difficult subject, and it's complicated by the fact that these are people. These are not robots. These are not things that you can just plug into a computer and get a result out. These are actual people.
Right.
So,
my next question is, today's world, I am one of them. I dealt with a rare form of cancer back in 2010 and then in 2011. It was called dermafibrosis sarcoma. And a lot of people nowadays are changing their eating habits and trying to go more of a natural approach. You got a lot of people who's trying to become vegan as an alternative to modern medicine. And I think I've stopped eating meat for about 3 years now. I did it as a support for my wife who was diagnosed with PCOS. And when she was diagnosed with PCOS, I decided that it was suggested that she stop eating meat. So I decided to stop eating meat as a support, but then I found out a lot of benefits from it. Now, what are your thoughts on this new uproar of people who are like, you know what? I'm not going to go to the doctor. I'm just going to work out. I'm going to meditate. I am going to, be natural. Do you recommend that they go that route and stay completely away from modern medicine, or do they still need some form of modern medicine?
Absolutely. And that's a great question. And you brought up two very, very valid points. So the first one, I'll just briefly talk about your experience with vegetarianism. So to understand vegetarianism or veganism, we actually have to go back almost 1,000 years or 5,000 years, because at that time, our ancestors, they lived out in the wilderness and all they could eat was whatever they could find. Mm-hmm. And so whatever fruits and vegetables and things in their community, the villages that they lived in, that's all they ate. And those people, by and large, were actually healthier than modern society. As people became wealthier, as people congregated in cities and so forth, now we saw a larger increase in people consuming meat. And meat, unfortunately, has two problems. One, the protein content is probably too much for most people, and a lot of that protein is unnecessary, so it causes side effects in our metabolism. But two, as I mentioned earlier, the corporate side of medicine, there is the corporate side of meat as well. And so what we're thinking about in meat isn't like a farm that's raising healthy cattle and so forth. These are more like factories, that are pumping antibiotics or steroids or other chemicals to make bigger cows and bigger chickens and bigger turkeys for a profit. You see what I mean? So we are actually eating the byproduct of the chemicals. Certainly the meat is there, but the chemicals, once they get into our bloodstream, the body doesn't know what to do with that, and that causes a little bit of issues. And so that's why people who are purely meat eaters, you can tell who that person is.
Right.
They look a little different. Their body's a little bit different. And that's because they're getting 90% of the chemicals, 10% of the protein, which is not supposed to be the good ratio. There's chemicals in everything, but unfortunately in the corporate side of it, with meat, it's actually a little bit toxic, unfortunately. So that's to answer your question about the vegetarianism. And so that's why there's a big push to go back to eating apples and, exotic fruits and so forth, because those, they may still have some fertilizers and things like that. And whether it's organic or not is separate. But by and large, those are just basic structures. You have your vitamins in them, you have your carbohydrates in them. Those the body can simply digest, use it, and be done with it. And the fiber content and all of those other good things are built in. So Mother Nature already created that. You might as well consume that first. Right. So that's about the vegetarianism for that. Now, the second point, which you brought up, is a very big, big topic, which is what I call naturopathic medicine. Mm-hmm. So again, with naturopathic medicine, we have to go back 5,000 years or 6,000 years when people didn't have doctors or tablets or prescriptions. They used herbs. They used traditional medicine. They used things that came from plants. And that is actually the source for most medications, even now. Mm-hmm. So if you take something like a blood thinner, or if you take a heart medication, I can guarantee 99% of the time that's actually derived from a plant or a root or something somewhere in South America, somewhere in the Amazon, somewhere in Africa that has been used traditionally in that community for treating heart disease or problems similar to it. The difference is that the tablet form is concentrated. So if you take something from a root, maybe there's a 1% chemical in there, and then when you concentrate it into a tablet, now you get 100 milligrams. You see what I mean? So people who do the naturopathic route, it does work. However, it works slowly. So people who go to a homeopathic doctor, like in India, they have Ayurvedic medication. If you go to a Chinese traditional herbalist, they'll have their little teas and potions and so forth, and they mix them in front of you. They'll show you kind of what they're doing. You have no idea what's there, but for many people it works, but in a low dose.
Got it.
And so if you're going to be using those, you can use them for maintaining your health. If you want to use it for some weight loss or some regulation of your blood pressure or blood sugar, I have no objection to that. However, if you have an appendix infection, if you have a kidney stone, if you have a stroke, those treatments are not going to work because those conditions are in the moment. If you have an appendix infection, the only treatment is surgery. You have to get the appendix out. Otherwise, it will burst and bleed, and then people will die. So in that case, taking anything natural isn't beneficial. That's going to be life-threatening. And the same thing with a stroke or a heart attack. You have to get through that window of the life-threatening event, which is when you're going to be seeing